My name is Ashok Raj. I'm the Division Chief of Pediatric Hematology, Oncology, and Bone Marrow Transplantation here at Norton Children's Cancer Institute. It's really a great time to be a pediatric oncologist. To give you an idea, I was born in the 60s. At that time, a child with acute lymphoblastic leukemia, if the child was diagnosed here in the United States, there was less than 10% chance of survival. Fast forward to 2021. Now there's greater than a 90% chance of survival. Science has brought us to a place which we could never have imagined in our lifetime, but we have to do a lot more.
I am Natalie Sloan. I'm a pediatric hematologist-oncologist at Norton Children's Cancer Institute. All of our patients, we want them to be kids. You know, there has to be time for those moments. Like, they can't just be our patients 24/7. They're not patients. They're children that we happen to treat.
My name is Jenna Blair, and I'm a senior at Manual, and I dance in the Youth Performing Arts School Magnet, and I also dance at my studio, the Louisville Academy of Fine Arts.
Front, 2, use your heads, 3, 4, breathe.
I've been doing the Nutcracker since I was in 5th grade, and this year I'm going to be the Sugar Plum Fairy, and it's my senior year, so I think it's a good role to end on.
April of this year, 2021, she had a terrible headache. We called and her pediatrician said, go in and take her to the emergency room.
And they found the tumor, and they said I would need to have surgery the next morning.
But that means chemotherapy, radiation, which she was like, okay, well, can I dance in my next show? You know, that's all she was really thinking about. But when she came to, she had severe short-term memory loss, and she could not use her left side at all.
Everything was just scary pretty much the whole way through.
My name is Heather Kays. I am a nurse with Norton Children's Cancer Institute. It's joy and sadness and hugs and love and tears all in one. I couldn't imagine doing something more fulfilling with my life.
It's all very scary for them.
I was afraid many times, especially when I found out I was going to have brain surgery. That was scary, and then I was diagnosed with cancer.
So anything we can do to make any moment of their time with us here in clinic or in the hospital more tolerable is important. And I think it's important for them to know that they're seen and that they're cared about and loved, that we're not just here to, you know, because we're paid to take care of them, because we care about them. Particularly for our oncology patients, the highs are pretty obvious when they finish treatment. The lows are also pretty obvious. Patients whose cancer have recurred, or when it looks like it's spread, or when treatment's not working. Those are some of the lower days, the lowest days. I mean, we really ask a lot of these kids. It's terrible. It's terrible to lose one. And usually what gets me the most is how thankful they are, even when their child has passed away. Because I tend to feel like I failed.
It's going to feel great. I just love being on stage.
She is cancer-free. And her cancer journey milestone would be getting back to the most normal that she can be. But to see her up there and get to dance with her sister in several dances will be amazing. Just hearing the music, like, you know, I didn't know she was gonna be able to do this one.
Yeah, I definitely can relate to a lot of the teenagers that are on the unit just because I am a cancer survivor. All of my nurses that took care of me at Norton Children's Cancer Institute made a really big impact on me. They're kind of what drove me to be where I'm at now. My nurses became like my best friends.
And it's funny because my husband will ask me, like, you say you love them? Like, do you mean that? I'm like, yes, I mean that. Like, it's not hard to love these kids.
Childhood cancer has been an extraordinary success story, but we still have to do a lot more. We need investment into research. We need to build therapies, at a much more rapid pace. And there are many children still battling cancer today who cannot afford for future discoveries to take place. They need those treatments to happen now. So for all the donors out there who want to contribute for the cause, I'll tell them you will be drivers of new treatments for childhood cancer.